guests, let's extend a warm welcome to our dignitaries onto the dais. Today, we are honored to have the chief guest, Member of Parliament, Srimati Kanimuri ma'am with us, and our very special guest, Dr. Evita Fernandez, Chairperson of Social Justice Monitoring Committee of Tamil Nadu, Mr. Subba Veerapandiyan sir, Dr. Balakumari ma'am, Dr. Ashok Kumar, Dr. Aruna Ashok and Dr. Ram Kumar to please come on stage for the inauguration. I now request Dr. Aruna ma'am to honor. Thank you, respected dignitaries. I now request Dr. Aruna ma'am to honor Srimati Kanimuri ma'am. I request Aruna ma'am to honor Dr. Evita Fernandez ma'am. I request Dr. Ashok sir to honor Mr. Subba Veerapandiyan sir. Thank you, sir. Thank you. Thank you, sir. Thank you, ma'am. I now request our dearest faculties and delegates, dignitaries to please rise for the Tamil Thai Varthu. Now, I invite Dr. Ashok Kumar sir, the Managing Director of A4 Hospitals, to deliver the welcome address.
Ladies and gentlemen, esteemed guests and dignitaries, welcome to the FOGCE conference. FOGCE stands for Fertility Obstetrics Gynaecology Continuing Education. Today, we are honored to have the Honorable Member of Parliament K. Kanimuri as our Chief Guest. Welcome, Madam. I also welcome the distinguished chairperson and managing director of Fernandez Foundation, Dr. Evita Fernandez. And I welcome the chairperson of Social Justice Monitoring Committee of Tamil Nadu, Professor Subba Veerapandiyan. Their presence adds great significance to our event. FOGCE is where empathy binds us in shared hope, expertise provides the knowledge to a doctor, and excellence defines our practices. I am humbled to see everybody for coming together to this FOGCE conference organized by A4 Hospitals and Fertility Center. The overwhelming response to the FOGCE magazine is a stepping stone towards in creating this FOGCE conference. FOGCE magazine lead us to the future in altruist way to understand that excellence is not an exception but a norm in healthcare. Let us carry the spirit of excellence from this conference into our practices, ensuring that every patient receives the unparalleled care they deserve. I want to thank people who inspired us to make this happen, each of you, the gynecologists, the obstetricians, fertility specialists, the andrologists, and the embryologists. And I want to thank the most to the medical fraternity in Tamil Nadu and India for giving A4 Hospitals and Fertility Center an occasion to host you all for the FOGCE conference yesterday and today. This humble conference aims to transcend medical boundaries, shall foster a collective spirit that elevates patient care. So let us begin to inspire, carrying the torch of compassion. And I vow to you that with integrity and commitment to fertility, obstetrics and gynecology's excellence, our committee will be thriving to make FOGCE a catalyst for positive change in the healthcare. Thank you for being a part of this transformative journey, and let us make the best of our day, which is today. Thank you.
Thank you, sir. Next, we have a speech by our esteemed chief guest, Srimati Kanimuri ma'am. We are here eager to hear her insights and perspectives. Ma'am, we please welcome you.
Vanakkam. I'm honored to be here in the presence of esteemed doctors and Mr. Subhavira Pandian, who's continued to inspire many young people, and he's opened their minds and started the thinking process and questioning in their minds. Dr. Evita Fernandez, Dr. Balakumari, Dr. Ashok Kumar, MD, A4 Hospitals, Dr. Aruna Ashok, Chairperson of the FOGCE Society, Dr. Ram Kumar, Organizing Secretary of the FOGCE Conference, and esteemed doctors here. Good morning to all of you. It is a very important point in because when we talk about the visions for the future of this world, we talk about empowering women, we talk about health care for women. But unfortunately, there is a big lacuna when it comes to the health care of women. One is we have been brought up again and again for centuries together. Women have been brought up with the mindset that their health is the last priority. It is everybody else who's important, the parents, the brothers, sisters, husband, children, in-laws, everybody is important, you come last. So women are very, very, very hesitant to take care of themselves because they feel that is an act of being selfish. The next thing is we're always conditioned to believe that talking about problems which a woman faces is wrong. It is not acceptable by society, starting from menstrual cycle, which is the most common agony, I would say, that women go through. I mean, it's not that everything, it's easy for every woman. There's so much pain, there are so many issues which come along with it. And slowly the world has started recognizing the pain, and there are many countries which give a few days off, and colleges understand that, it's not a normal day. But we still are hesitant to talk about it. Still families expect you to stay away from being a part of the household on few days, and still it's shocking that there are places where women are expected to go and stay in huts just built for them when they are menstruating, and they are supposed to stay away from the village in very unhygienic conditions. So this is how society looks at women's problems, women's issues, and so we are very, very, very hesitant to even share it with people in the family. If many women have breast cancer and it goes undetected because they are very hesitant to talk about that. Pelvic cancer is another problem which many women are facing today, but they are very hesitant to talk about it and get help in the initial stages. So with all these hurdles, with all these blocks, our mindsets have to change. We have to reach out to women, make them feel normal, make them feel comfortable in their own bodies, and make them also understand that they have a right to life, they have a right to an empowerment over their bodies. Because even today, women do not have choices, women do not have a say when she wants to get married, when she wants, still child marriages are, the numbers are appalling when you look at the figures. So child marriages are still acceptable. Moreover, one is society deciding, families deciding that young girls should get married because it's one burden off their heads. And a lot of young girls do not understand the complications, do not understand what are the problems, and so they choose to get married early. They elope early, and then they become very young mothers and have to face the consequences. Your future, your career, everything becomes a big, huge question mark. So when we talk about child marriages, when we talk about issues, women, and you cannot choose when you want to become pregnant. A woman cannot choose whether she wants to be a mother or she does not want to be a mother. And it's always, whether it is, I'm sure you all know better, it is not the woman, or she is not the person, or her body doesn't decide whether child is male or female, it is the man's body. But still, always the women are blamed. Families throw daughter-in-laws out because they've had 3 daughters, 4 daughters. There are divorces. So all these luggages which women carry are becoming a huge burden for their empowerment, for their careers, for their choices in life. And I think the greatest feminist in this country, not just this country, I think the greatest feminist I've come across in this world is Periyar. Because he said anything which stands in between a woman's dream and achieving it should be broken, should be done away with. He had the courage to say, just not now, decades and decades ago, that women should make choices about their body. Women should make choices about what she wants to do with herself. The fear of society that something might happen to her, that she might get pregnant, all that should be broken. And it, having a child, not having a child, stopping it, postponing it, everything should be in the hands of a woman. And when she has to make a choice, I think awareness, அதை பற்றி ஒரு விழிப்புணர்வு அப்படிங்கிறது ரொம்ப அடிப்படையான ஒரு விஷயம். Without the awareness, without knowledge, without knowing, without understanding, then when you make a choice, the choice is never right. So knowing what is there, knowing what is installed for you when you make a particular choice, what happens, this knowledge about health, and overcoming the conditions which we've been made to believe for centuries, which our mothers, our grandmothers, our aunts have been teaching us, because they've been taught to believe all that is true. All that can be broken away, done away with, and we can only get truly empowered when that knowledge is there and we start accepting our bodies as normal, natural, and something we are proud of. And today, what they're doing today is to normalize the body, making it a woman's body especially. I mean, everybody is comfortable objectivizing it, looking at us as objects, but nobody is comfortable looking at a woman as a normal human being who has choices to dress the way she wants. A woman should decide whether she wants to wear a parda, whether she wants to wear a sari, whether she wants to wear a mini skirt, or whatever she chooses and makes her feel comfortable. Nobody has that right. And I think society should be taught to look at women as another human body which needs and has every right to be seen as an equal. I think today what they've started will ensure that the true empowerment of women and empowerment of women over themselves will start today. Thank you, and all the best to all of you.
Thank you, ma'am, for giving us a great insights into the major hindrances to women empowerment, that is by creating more awareness and changing mindsets and perspective, we can merely improve women empowerment. Thank you for this enlightening speech. It is quite inspirational. And I request Dr. Aruna Ashok, Secretary of FOGCE Society, to share the vision of FOGCE.
Very good morning. I think Madam Kanimuri Madam's talk, we are all empowered women. At least to 75% we are all empowered women who are sitting here, and we are helping many women to get empowered in their journeys. So definitely, I'm very proud to have you here, madam. So we are honored to inaugurate our FOGCE Society today. At FOGCE Academic Society, we would like to constantly update ourselves and help young practitioners to update themselves by magazines, monthly webinars, and preventive fertility and obstetric practices. We are proud to release our FOGCE magazine 3rd edition in this forum. At A4, we are continuously trying to be in alignment with the latest advancements in evidence and make significant strides in advancing the field of reproductive medicine. The magazine includes the inclusion of case studies in reproductive medicine, obstetrics, and gynecology. In each edition, we have a featured article from the expert and seniors in the field of ONG. It not only provides insights into real-world scenarios, but also contributes to collective learning of medical professionals. The emphasis is made on practical protocols aligned with latest evidences and NABH standards. The first and second edition was well appreciated for the educational contents. In the next edition, the third edition, we are having the conference articles, 3 of them getting published. In the forthcoming edition, we'll include the special speakers who have contributed for this conference. We at FOGCE Society also aim at preventive fertility and obstetrics. We are already started educating college students about the need for correct age of marriage and childbirth process and choices. This approach not only caters to the needs but also addresses broader aspects of reproductive health, awareness, and education. We strongly believe that preventive obstetrics and preventive fertility is the way ahead to become a developed nation. We are happy to launch the Fertility Handbook of Nurses. We as doctors know how crucial and important our angel nurses play in everyday role we have. In the nurses education program, hardly any training is given on fertility and reproductive medicine. So when we wanted to train the nurses in fertility, it was difficult without a curriculum and handbook. Using the international books to train our nurses was not useful anyway, because the practice in international forum is definitely different from Indian scenario. So the idea came from the conference we did to train nurses a year ago, that this book is in need. It's crucial for nurses to have a holistic understanding, not only just the medical aspects, but also emotional and psychological needs a patient with on fertility treatment is undergoing. We have made the chapters of handbook to be very practical, simple English and easy for understanding. We very well know that we all have studied in good colleges and we have had English knowledge so much, but number nurses kita pesumbodhu we directly talk to them in their mother tongue. So we wanted the English to be very simple in this book so that the nurses can understand it, and soon we will come with a Tamil edition of this book so that they will have a concept clear in their mind. So kindly go through the magazine and give your comments. Fertility specialists, donate this handbook to the staff nurses who are sincerely working with you to deliver the best care. We wanted our chief guest to launch the magazine first and then the fertility handbook for nurses.
As ma'am said, a special moment awaits us as we release the Fertility Nurses Handbook. So I request Srimati Kanimuri ma'am to present it to Dr. Evita Fernandez ma'am. I request Srimati Kanimuri ma'am to present the Fertility Nurses Handbook to Dr. Balakumari ma'am. Thank you, dearest dignitaries. Concluding this ceremony, we will express our gratitude with a vote of thanks by Dr. Balakumari Ma, President of FOGCE Society. Ma.
A very good morning to all of you. It gives me immense pleasure to give vote of thanks. முதலில் செம்மொழி வளர்த்த செம்மலின் வழிவந்த கனியாகிய திருமதி கனிமதி அவர்களே, திரு சுகவீர பாண்டியன் சார் அவர்களே, மற்றும் அன்பு அறம் அரண் ஆளுமை நிறைந்த கலவையின் பிரதிநிதிகளான டாக்டர் அருணா, டாக்டர் அசோக், உங்கள் ரெண்டு பேருக்கும் ரொம்ப நன்றி. நாம் கற்ற கல்வியையும் பெற்ற திறமையையும் பகிர்ந்து கொள்வது என்பது ஒரு மகத்தான வேலை. ஓகே, அப்போ நம்ம சமுதாயம் இன்னும் மென்மேலும் மற்ற உயர்ந்த சமுதாயமாக மாறும். இப்போ நீங்கள் சென்னையில் இஃப் யூ வாண்ட் டு பி தி ஹப் ஆஃப் தி மெடிக்கல் டூரிசம் அப்படிங்கிறதுக்கு நாமெல்லாம் ஒரு முக்கிய காரணமாக இருக்கணும். யங்ஸ்டர்ஸ் டேக்கப் இப்போ இந்த ஆப்ஸ்டெட்ரிக்ஸ் அண்ட் கைனக்லியே சப் ஸ்பெஷாலிட்டிஸ், அடலசன்ட் ஹெல்த், கவுன்சிலிங் ஃபார் ஃபர்டிலிட்டி, டிரான்ஸ்ஜெண்டர் ஹெல்த், இந்த மாதிரி சப் ஸ்பெஷாலிட்டிஸ் நிறைய எடுத்து நல்லா பண்ணணும். அதுக்கு யாராவது ஒருத்தங்க இந்த மாதிரி ஸ்பெஷலைஸ் பண்ணவங்க நம்மோட இந்த நாலேஜையும் ஸ்கில்ஸையும் ஷேர் பண்ணும்போது நமக்கு நம்மளை இம்ப்ரூவ் பண்ணிக்கிறதுக்கு ஒரு வாய்ப்பு கிடைக்கிது. இந்த வாய்ப்பை கொடுத்த A4 ஹாஸ்பிட்டல்ஸ்க்கு ரொம்ப நன்றி. Dr. Evita Fernandez has been a pioneer in obstetrics. She had been she doesn't know, but I had imagined her as my role model. where you give a complete obstetric care. Okay, it's not about who can afford or who cannot afford. Okay, to do the correct thing and to train the youngsters, that's very important. And she had paved the path for that, and we hope to follow your path in taking obstetrics to a higher level. And to all the faculties who have taken trouble to prepare the topics and give your presentation, and to all the delegates who could make it in spite of the rains, thank you all so much. It will be incomplete if I don't mention about the organizing team. The main part, படை தளபதின்னு சொன்னால் டாக்டர் ராம்குமார் தான். அவரோட சேர்ந்து எல்லா டீம் ஆஃப் A4 ஹாஸ்பிட்டல்ஸ், I can't really name each and every one of them, starting with Williams and ending with all the nurses who helped to organize things to make it very, very peaceful. Thank you all so much. Thank you.
Thank you, respected dignitaries. We now conclude the inauguration. Thank you, ma'am. Thank you, Srimati, Dr. Arnav, ma'am, Dr. Balakumari, ma'am, Srimati Kanimuri, ma'am. Thank you, dearest dignitaries. Conference begin with inspiration and knowledge. We have a lot of scientific conference sessions in the afternoon, post lunch, and now we would have snippets and followed by a session. So please stay tuned and stay where you are.
Now I would like to invite Dr. Anjalakshi to felicitate Dr. Kalevani. Next I would like to invite Dr. Vijaya ma'am to felicitate Dr. Josephine Rossi. Next, I would like to invite Dr. Aruna Ashok to felicitate Dr. Vijaya. So I would like to invite Dr. Ashok sir to felicitate Dr. Vijaya.